Now we're going to talk about our third mystery molecule, very poorly understood. Prolactin is usually associated with women and lactation. It is released by suckling of the baby on the nipple of a woman, and prolactin goes way up. It's also associated with sexuality to some degree. It's a relaxing hormone. After sex, most people's prolactin kind of goes up and they feel more relaxed. It's also, there's about 300 different actions of prolactin. Now, I believe every male with low testosterone should have a prolactin measured. The reason being that there are a number of men who have pituitary tumors, which are called prolactinomas, that secrete prolactin. And these tumors can be big enough to the point of pushing on the optic nerve roots and lead to visual problems. So if the first thing you do is probably challenge and see if you can treat the high prolactin with a drug called Dostonex, also known as cabergoline, and the dose is 0.5 milligrams per week, but it's taken as 1/2 of that, which would be 0.25 milligrams every 3 or 4 days. If that brings down your prolactin and you do a scan, an MRI, which shows shrinkage of a tumor of the pituitary, then you've kind of maybe cured the problem, maybe not. However, if the prolactinoma, I'm talking about the tumor that produces prolactin, keeps growing despite using medical therapy, then you do need surgical intervention. And the way you do surgically is actually you have to go through the nose. It's called transsphenoidal pituitary removal. And I've had several patients who've had to have this because when prolactin goes up, testosterone goes down. So that's the big issue, is getting testosterone up. So you can, first of all, treat it medically with these 2 drugs I mentioned, cabergoline, known as Dostonex, or Parlodel or bromocriptine. Problem with that is you have to take that every single day. But those drugs can be very valuable. The other thing I like about cabergoline, and it does have some sexual effects. If a male has a prolactin, let's say of 17, 18, the normal is up to about 15, and the bottom is maybe 3, and it's that high range, I find these men do much better sexually, and they seem to have, in some studies, a pro-ejaculatory effect, that there are men who just have difficulty in ejaculation, and prolactin seems to enhance that so that they're not having difficulty in achieving orgasm. I didn't really mention some other causes outside of tumor, but there can be prolactin elevation from medications, especially your psychotropic medications, the ones used for various mental disorders. There's opiates, anticonvulsants, antihistamines, estrogens, and others. And there can be just trauma to the pituitary gland, which can cause problems with prolactin levels. The bottom line is that prolactin has to be measured in all men that have low testosterone, since high prolactin means low testosterone. And you're using medicines to counteract that, which can be done very successfully.